All right, so we are going live looking for Kyle Stanley. Let's see how to do this thing. I don't know. I see his face over here. We are going to do. Nope, that's the wrong thing. So we're going to do an Instagram live right now with myself and Kyle Stanley, who is a very talented dentist out here. We have. Let's see, where is he? We'll find him in a second. So we have a meeting coming up in Miami this coming weekend, so Friday and Saturday, and it's a combined course with plastic surgeons, facial plastic surgeons, orthodontic, oral dentistry, everybody, where we're coming together to talk about the mouth. And Kyle and I work together a good amount. We've lectured together about the combination of lip lifts and corner lifts and other types of enhancement, and really combining plastic surgery with dentistry at the same time. You requested, Kyle. I don't see it. Let's see how that works. Hold on. Go live. Oh, I see it. Okay. We should get Telly Swift on. My friend. All right. So I'm waiting for Kyle to join. Saludos desde Queratetro. Okay, so we're gonna have to do this in Spanish, Kyle.
Ok, eu posso falar em português? Português é bom?
Português ou espanhol?
Os dois.
Yeah, there you go. So we're actually, I don't know if you're going, I'm doing Flavio has a meeting in September that I'm talking at.
Oh, nice.
Are you going to that in Sao Paulo?
I got invited to, but I couldn't because I was gonna be in Lisbon.
Lisboa.
Em Lisboa, exatamente.
Nice. Well, you gotta, wow, no portugués, solo español. There you go. All right, so yeah, for everybody, it's what we do together with dentists and plastic surgeons is we try to make the mouth look better in general. So we're not just doing teeth, we're doing lips and everything like that as well. So Kyle sometimes has sent me patients to do a lip lift on them or to dissolve the lip, or even we had a couple patients who had some silicone in the lip that were injected before that we wanted to make look natural, because fillers and silicone and that kind of stuff in the lip can really weigh down the lip. So Kyle and I have been working together for a couple of years now, done several cases together, and the patients look way better than when you send them in just doing one thing or the other. So if anybody has questions about this stuff, please ask. The whole idea of what we're talking about, we're going to have a meeting in Miami on Friday and Saturday of this coming week, called the Orofacial Club. And that's with Chris Coachman, who is, I don't know how to describe him. He's like you. So Kyle is like a supermodel dentist, and then Chris is also, I'd say, like a supermodel dentist.
Yeah, he's a superman. In our world, he's a big leader, a big thought leader. He brought a lot of new ideas to what we're doing. So for me as a dentist, it's an honor to be even just friends with Christian.
Yeah.
So
yeah, he's awesome. Oh, you gotta mashallah and saludos. That's two languages there. Mashallah and saludos. Yeah, donde opera él opera en Beverly Hills y yo también. Estamos muy cerca al otro. So I'd say I think the combination of what we're doing now, it's actually taking wind, and there are people joining forces, not just in Beverly Hills, but in other parts of the world, since we've been talking about this more and more. And I think we've started seeing that we all rely on each other, or should rely on each other more. Ooh, I got a compliment. That's good. Nobody ever compliments me. This is nice.
You should do more Instagram lives then.
Yeah.
My phone keeps falling. Yeah, so I think with
it's open to the public for all practitioners. But yeah, go ahead.
Right. Yeah, and that's the idea, is that we're going to have people speaking that are orthodontic surgeons, that are oral surgeons, that are dentists, that are plastic surgeons. We have people from the beauty industry talking about beauty and why people are striving to be beautiful, and the psychological side of it. So it's not just clinical, but we also have the psychological side. It's the first meeting of its kind, so it's really exciting.
Yeah, so we actually have Chris Sawyer. Chris is she also used to be a model. So she's Brazilian, and she's coming to Miami to talk, and she's going to talk about what she calls the quest for beauty, or understanding beauty. And it's important for all of us who are in the world of aesthetics to get a grasp on it, not just go learn about, you know, doing a lip lift or doing teeth, but really understanding like what makes people beautiful, or what we all see as being beautiful. And she is going to talk about the different, I'd say, perspectives of beauty around the world. And then we have a psychologist coming in, and she's actually going to be talking about the psychiatry, the psychology of beauty and dysmorphia, and a bunch of other things, which is great, because I don't know if on the dental side of things, if you get patients who are dysmorphic like we do.
For sure. Yeah, no, we for sure do, you know, and it's probably the same like you, as they say, you know, I went to 5 different doctors and they all tried and couldn't do anything, and then they think that you're going to be the one to help them. And sometimes I think a lot of younger practitioners are like, their ego's there, and they say, yeah, I'm the one that's going to be able to do it. And they get in some bad situations, I think.
Yeah. I mean, I spend probably 30% of my time dissuading people from doing surgery. So yeah. I talk them out of it. The most difficult thing I've seen to treat, and this kind of advice to everybody who's not a doctor or is a doctor, is, you know, don't inject things into the lip like Bellafill, Artefill, silicone, you know, things that you can't fix. There's always a chance that it's going to go wrong, and what do you do if it does? It's really, really difficult to fix. So that's where I struggle, I think, with everything else, or more than anything else. And otherwise, since I've been working with you, life's gotten easier, because I don't have to go lift somebody's lip to the sky in order to get a really nice smile. I lift it to an appropriate amount, and then I can send it to you, and you make the teeth look good.
Right.
I do have a case that I need your help with at some point, and that's Veronica, who's in my office. And I haven't talked to you about it yet, but I did a facelift on her, a lip lift. I don't know if you remember.
Yeah, I saw the pictures. Mm-hmm.
Yeah, but I only did half a lip lift. I did half of what I wanted to do, because I didn't want to expose her teeth. I didn't like her smile. Her smile's kind of a little crooked, and I thought it would have imparted a harsh look to her face. So I did half a lip lift, but I want to do the other half now, so I might have to send her to you to
even everything out.
Yeah.
I think that's the beauty of it, is that when I first started talking about this, I think a lot of dentists thought I was crazy. Like, why are you even incorporating plastic surgery? That seems like too much. But it's exactly what you said. Like, we can only do so much. If we move the teeth, we can make the teeth so long to where it makes the patient's maxilla look too long, or it just makes their face look unaesthetic, but they finally show teeth what they want. And that's really not the best way to do it. It should be bring the teeth to where they need to be for function and for aesthetics, but then also sometimes I can be more minimally invasive by sending them to you. And this is what people don't understand, is that they oftentimes think that, oh, why would you go in and do this large surgery? They realize it's not that big of a surgery once they see you do it. Mm-hmm. But I say, well, sometimes we don't have to do anything. Maybe we just bleach and do Invisalign and a lip lift instead of doing, 12 veneers and implants or whatever. We can do minimally invasive dentistry by having the plastic surgery involved as well.
Yeah, and I love the idea of minimizing, because we want everybody to look delicate, go through less torture and all that. So I'm a big fan of minimizing, and I can't always do it by myself. So it's nice that we help each other. Somebody asked, how I feel about Juvederm. Juvederm, in the world of fillers, is probably the most commonly used for the lip, but that does not mean it's the best for the lip. It's just, you see how people look, and they don't always look natural. So it's the most commonly used for the lip. My advice to injectors is to have Juvederm as the last option. So the first option should be different types of Juvederm, meaning you could use Volura, Volbella, or you use Restylane. I just use Restylane. The problem we have with Juvederm, and it being the most commonly used, is that Juvederm is an inflammatory migratory filler, which means you might go and inject it right over here, and then 2 years later, it can pop up over here. Once it pops up here, it'll last 10 years. It's not going to go away. It just lasts. And when it does that, yeah, exactly, Juvederm. So the thing that happens with Juvederm is that it starts to splay the muscle. It integrates into the muscle and it weighs it down. And that leads you to have something we call an incompetent lip, which is a non-functioning, flabby lip. And if the muscle's not working, your resting tone, which contracts the lip, is gone. So all of a sudden, the lip lengthens. And it's not a natural age.
And then the patients complain to me.
Yeah.
And they come and say, I need my teeth longer. And then I need my lip longer. I need my teeth longer. I need my lip bigger. I need my teeth longer.
Exactly. And they don't see it. And I've had patients who said, no, you know, it's impossible that I have it. And they start trying to argue with me about the possibility of what I'm seeing very clearly. And they say it's impossible.
I've seen it firsthand when I'm doing surgery with you.
Yeah. And they say it's impossible. So I tell them, no, I see it. And they said, well, no, it's impossible because it's already been 3 years. Okay, well, it's not impossible. And they said, well, I've already had it dissolved. The other thing is doctors inject it here. So when they dissolve it, they go and dissolve it here. They don't realize that it's already migrated up here.
Right.
So I advise pretty strongly against Juvederm unless there's a reason to use it, meaning somebody has dry, dehydrated lips or somebody doesn't really retain other fillers, then you use Juvederm. And it has its benefit, but it carries 6 times its weight in water. So someone asked, are we going back to the natural look, no more fillers? Fillers can be very, very natural. It's just a matter of who injects it. So, there's a saying, guns don't kill people, people kill people. Well, fillers don't jack you up. It's the injector injecting you who can jack you up. So there's always a role for filler. There's always a role for surgery. However, a lot of people now, instead of doing these fillers, are going to doing lip lifts because they're realizing they don't want to keep adding and bulking, and this is being realized worldwide. Kylie Jenner publicly said that she did it, and she went and had her lips dissolved, and they were big and a little larger than what her tiny face wanted, and she looked amazing afterwards. So she didn't say she's not getting fillers. She just reset it, got rid of it, and then went and refilled again in a much more delicate way. Can you do a lip lift on someone who has silicone in their lips? Yes, and that's one of the main things we actually do is people have lengthening from silicone.
I've been there when you've done that.
Yeah, and the silicone, and here's for Fancy Nancy, silicone can't be removed from the lip unless there's a ball of silicone or a silicone implant. So silicone usually goes in and integrates into the lip, and it causes what we call a kind of hypertrophic reaction where it starts to thicken everything, and that happens over the course of usually starting at about 5 years and then goes on perpetually for life. And
I remember that one patient that we were doing when I was there, and you were like pulling silicone out.
Yeah. So you can't get rid of it. Like, it integrates in, and if there's a ball of it, you can try to get rid of it. But in general, someone who has silicone for life. And it's good to know that because you don't want to go overly treat someone with silicone thinking you're going to fix it. You're not going to fix it. You're going to make it a little better, and they're going to have another problem later, and you're going to have to fix something again. So it is a lifelong problem. Not
Hey Ben, before we started working together, had you worked with any other dentists?
No, you're my first.
You say that to everybody.
Yeah. I hadn't really worked with too many dentists before that, which is sad. And that's with me. I do like 8 lip lifts a week, so that's sad that I hadn't. But I think the popularity hadn't increased as much as it is now, and the dentists don't follow in general on social media or anything what plastic surgeons are doing. They kind of do their own thing, and they're in a dental world. So.
Well, I think that things are changing since we started talking about this, a few years ago. I mean, I'm getting people all over the world now sending me pictures saying, hey, do you think this patient could use a lip lift? And, I'm thinking about doing veneers, what should I do? So after I published that paper, that helped. And then I think with you and I, talking about it, and also Christian and the whole Orofacial Club discussing this kind of stuff, it's changing. And I think people are understanding that if you work in the face, you need to know what's happening. not just in your specialty. But you don't necessarily need to know how it's working. You just need to know what's possible.
Yeah.
And like Christian says, you need to know what you should do in your first appointment to figure out who the patient needs to see to really get more holistic treatment.
Yeah, exactly. And so for everybody who doesn't know Kyle, what he does is he's in an office, works with Matt Najad, so they're two dentists working together, and Helms is there too. But
Yep.
generally, what they do is something called smile design, and they will map out the teeth. They take a look at it. They take a look at the whole face, the soft tissue, and the bone, and they try to match up what would look best, and they try to give you a mock-up or a rendering of that, so you can actually see what it looks like. So smile design is, we're in 2019. If you're not doing smile design, I think you're a little behind.
Yeah.
And it's
yeah,
really
it seems weird to go, and this is how a lot of people are still doing it, is you say, I want my teeth to look better. So the dentist prepares the teeth, they put the veneers on or implants or crowns, whatever, and then they say, what do you think? And it's just such a risky thing now when you can go ahead, the patient can try it in their mouth, they can wear it home, they can, ask their husband and wife, daughter or son, whatever, and get an idea if this really works with their face. We can take photos and videos and see if it functions well. And like you said, looks delicate, looks natural. And then once, I'm happy or Matt's happy or the patient's happy, you're happy, then we can say, okay, yeah, we're good to go.
Yeah, because what we see in LA too often, and this is including some of my friends who even travel to get veneers and things like that, is they get like big chiclet teeth, like chicle. They have like big giant horse teeth, and they over lengthen, they over bulk, they over project. It's not aesthetically pleasing, so it's nice.
And a lot of that is due to the lip too. Like you said, they may over project because when you project, the lip goes up automatically. Or they lengthen because if the lip is too long, they lengthen and want to show more teeth and look younger. And then they think that by showing more teeth, they're going to look younger. And usually that's the case, unless the lip has lengthened. Yeah. And that's when no matter what you do in dentistry, you're not going to help the patient look natural and look delicate. You're just going to make them have that duck look because they have that long philtrum that can only be fixed by plastic surgery.
Yeah, and that's the goal of this meeting that we're having, the Orofacial Club meeting in Miami on the 14th and 15th is, number one, we're going to wake everybody up and say, listen, because there's going to be enough people there who are big that are going to spread the word in their communities. And the first thing is wake up and see that you do have to look at a patient from someone else's perspective to say, okay, there's things that I don't do that are possible.
Right.
Then we're going to give people the tools to actually do that, meaning we're going to talk about the techniques and how we coordinate and all that kind of stuff. And then we talk about addressing the patient's needs or the patient's psyche. So we're going to have people there doing that as well. So I think it's going to be awesome for all that.
Yeah, and at the end, we're working on getting a consensus. So getting the oral surgeons together, orthodontic surgeons, the plastic surgeons, the cosmetic dentists, the surgical dentists, everybody together, and saying, what's the best way to do this? Right. Because we have our team that we've worked together multiple times and know how it works, but it may work different in someone else's hands. And everybody has their little specialties. So if we can get this consensus, we can educate the general medical community and more people can start doing this oral facial treatment and thinking about the smile and the cheeks and the nose and injectables and everything together.
Yeah, I agree. And here's some questions we'll answer as we're going through it. So I'll just catch up, for whoever's on here. So for Swift Shelley, all fillers migrate. All fillers can migrate. Typically, Restylane and those fillers, they migrate maybe 1 or 2 millimeters, whereas Juvederm can migrate about 10. So it's very different, and it's much more prone to migrating. Are there risks when dissolving a lip filler? Yes, but minor. You might just end up seeing some wrinkles that weren't there from stretching or little indentation, and you can always refill it with a tiny bit of HLA if you need. Best tear trough filler is Restylane. Second best is Belotero, and then probably third best is Volure. But I don't like using those products. I think Restylane is the best one for the lower eyelids. Lips starting to look really good. 2.5 months, fantastic. Takes 3 months to get there. Dubai, I'm on hold on the next Dubai trip. I am working out some things with timing, so July I was supposed to be there, but it might be a little bit longer for now. Oh, here's a question for you. What's a good CE course for dentists to learn about these aesthetic multidisciplinary options. Well, let me mention one thing. So we have this coming up, which is the Orofacial Club in Miami that Kyle will tell you about. The other thing is Kyle and I are giving a lecture in July in Beverly Hills.
That's right.
About lip lifts, specifically the patients that, who would benefit from it, and our coordination between the two of us and Smile.
Yeah, how to do the collaboration with Smile Design, when to do it first, when to do it second, when to do dentistry first or a mock-up, before you do lip lift or after lip lift, or orthodontic surgery involving any type of dentistry.
Yeah, and that's going to be at the London Hotel. So that's a very mini version of what's going on. So that's just Kyle and myself. And then in Miami, we've got everybody. Miami we have Brazilian, Spain, New Yorkers, LA,
Chile.
Yeah.
Mm-hmm.
Everybody's coming to that and giving their own take on how things are done. Even the lip lift experts, we've got Randall Hayworth, Jeff Spiegel, and we all do things very, very differently. And that's what's awesome about it. Spiegel and I do things very differently. Hayworth and I do things very differently. And they are people I greatly admire and respect, and they get awesome results. But they approach it differently. There's different ways to skin a cat. So it's nice to see how they approach it. And even Randall, his lip lifts look completely different than mine. His have this, a little bit more of a lush kind of sexy look to it. And Dr. Spiegel, he's got less downtime than me. So we each have our benefits, our pros and our cons to how we do it. And that's the good thing about this meeting is you see how everybody does different things. Now from the dental side, we'll see that too. What kind of Juvederm is considered silicone based? What kind of filler do you mean is considered silicone based? So silicone is the only thing that's silicone. Artefill, Bellafill, Articol, anything that sounds like that, that's a semi-permanent filler, is silicone-like. So there's PMMA, which is polymethyl methacrylate, and bioalchemid polymers, and they're all silicone-like. So pretty much assume anything that's semi-permanent is silicone, and that's how it's going to work. Even fat injected into the lip can act like silicone sometimes. If it
Interesting.
Yeah.
I didn't know that.
Yeah, you got to be very careful. Hi from Jersey. Hi, guys. What's the cost on lip lifts? That depends who you go to. Nobody good in the country that I've seen is under 4, but 4,000 is like the typical, I think. And then it goes up from there up to 20, depending on who you go to. Do you completely discourage Juvederm XC for NEH? Not completely, no. If you have another choice, I would use something else. But if you have lips that are super dry and dehydrated looking and you can't get them filled with anything else, that's when I like to use the fillers. Treatment option for a hypomobile upper lip post filler treatment. Dissolver first and then see if you need a lift. Cannabis is fantastic. Everybody loves it. How do you feel about teeth whitening?
I think teeth whitening is great if it's done correctly. And so what that usually means is custom trays made by your dentist that are very specific, that go around the gum margin so that the whitening gel doesn't go away. And then it has to be 10% carbamide peroxide and done overnight. Those little lights that you see on Instagram and in people's offices, they do absolutely nothing. So don't waste your time.
Do I need it?
Let's whiten your teeth. Why not?
Yeah. That's I just want to smile in a dark room and light up.
Yeah, it's nice to have for camping.
Yeah. So which treatment goes first? That's part of what we figure out together. We always talk and we see if there's a benefit to Kyle going first or to me going first. Then we kind of see whichever one's the more predictable or has the most. Yeah, I say the most predictable goes first, and the most flexibility goes second. So it really just depends on the patient or whether or not they're doing orthodontic surgery, which is a whole nother thing. But in general, if it's somebody with really jacked up teeth, Kyle's going first. Kyle goes first, fixes them, makes them nice, and he already knows how much I can lift it, so he's going to make them height appropriate anyways.
Yeah, and that's part of once you start working together more, and this is why I said the dentist needs to understand what's possible and the plastic surgeon needs to understand what's possible. I don't need to know how to do the lip lift, but I need to know, hey, Ben, I know you'll be able to get 3 more millimeters of showing, or I know you won't be able to, so I may need to compensate with the teeth. And then we don't have to have as much unknown.
Yeah, exactly. So Jennifer's asking, what's the difference between a lip lift and a modified lip lift? A lip lift, when we're talking about lip lift, there's different types, but the majority of the time it's a bull's horn lip lift, and that's just the description of the incision across the base. What makes it a modified upper lip lift is that we do something called a deep plane release or subsmass dissection, which means we're actually going and releasing the smass, which is a fascial layer, from the muscle, allowing it to roll. So you get more even of a lift all the way across. You get a little bit more substantial lift, so you can take off 11 millimeters on someone with
And less scarring.
And less scarring, yeah, and less pull.
Because you don't have tension on the flap, right?
Yeah, exactly. And so that's the first thing, is the elevation, and then the suspension. It's suspended to something called the piriform ligament instead of skin. So classically, it's just skin to skin. This is actually anchoring nicely. Is it true that you can't remove all the fillers you've injected in your face? It's not true. You can remove all the fillers you've injected in your face. However, I'd advise very, very strongly against it, because it will attack your own hyaluronic acid, and in some places it won't rebound. So under eyes, it's pretty forgiving. You just get a pretty severe dehydration in the beginning. This area is not forgiving. So if you inject dissolver into this area, you could get a deflated cheek, and it will take you years to get back from that. So you have to be very careful dissolving. Lips, you can dissolve all day. They're not sensitive to it, and they're fine. Come to San Francisco. I would love to. Any courses for lip lift in the States? Well, yeah. So Miami, the 14th and 15th, is the Orofacial Club, and you're going to hear from Oren too. You're going to hear from 4 different lip lift experts. Which is the best for the lips? The filler, I like Restylane the best. When do you have any work in SF? Don't know. What do you think about threads with Sculptra? Different topic, but they have their uses. I'm just very cautious about using them. My dentist is doing Invisalign, and he's going to toughen them up for a veneer instead of grinding it. Do you think that that causes overprojection of my teeth?
It can. It depends on if there's room or not for your teeth to expand. Because oftentimes when teeth are crooked, in order to get them straight, you have to expand. And if you expand outside of the bone, you can have problems. But, I'm sure your dentist is doing it well, and there's ways to do it correctly. But I would always say do Invisalign first before going to veneers or crowns or anything like that, just because it's more minimally invasive.
Yeah, so Ben, take off your shirt. I don't think there's anything good to see, so he can't. It's PG-13. There you go. Is Juvederm Voluma good? Voluma is an excellent filler for the cheeks and for temples, but not for the lips. So don't use it on the lip unless you have to. What's a good toothpaste brand? 4 out of 5 dentists would recommend. I think everyone's doing Sensodyne now more than anything, no?
Yeah, Sensodyne is good. I can't think of the one that we have. That's really, really great. Oh, I'll have to think about it. I'll post it once I think about it.
Yeah. How does sharing a patient work? Sharing is caring. Does Juvederm Voluma move? Not as much. No, it doesn't move very much. I had a nose job last month. How many months before a lip lift? Generally about 3 if they did an alarplasty. So if they narrowed the nostril base, you want to give it about 3 months for that to mellow out before you do a lip lift so they don't fight each other. Otherwise, if no nostril base stuff was done, you can do a lip lift the next month, as long as the first surgeon, the rhinoplasty surgeon, says it's okay. You can also do them together.
Yeah, or a few of the ones that we've done, you've been doing lip lifts and rhinos at the same time, right?
Yeah, it's very safe. I do it. Spiegel published about it as well, and there's other papers published on the safety of it. You just don't do an alarplasty at the same time. You do that later. I want to treat my patient with Botox to flip the lip. That works a little bit. It gives you just a little bit of curl on the top. It's not a big lift. But it does help people who kind of do this a lot. So it does relax it upwards a touch. Your teeth are perfectly white and beautiful. I don't think Dr. Stanley agrees. We should get a little whiter.
No, they do look good.
Yeah. Let's see, in New York. Yeah, well, I'll be in New York in a couple weeks to see Dr. Perlman's new office and to watch a very important play. How do you prevent calculus buildup under implants, and is it biological with violation related? Ooh, that's
a good question. Preventing calculus
level question.
You have to have a restoration. This is my jam. You have to have a restoration that is cleansable. So if you have something that has like a ridge lap, it'll never be cleansable. And does biologic width
dilation involve calculus buildup? No, I don't think so. But biologic with invasion will cause bone loss on dental implants.
Yeah, that's all Greek to me. Is industrial silicone okay for self-dentistry? I'd say no. Why do we even have teeth? Why not just one long curvy tooth? Well, because if you lose that one, you're kind of
DJ Darkwest throwing up those good.
I love it. Oh, wait, I lost you a little bit there. I don't know why I can't hear you.
Possibly.
Oh, there you go. Yeah. So Dr. Bang, can I get a consultation in Dubai, but have my surgery in LA? Yes, but I mostly just do the FaceTime consults or Botium or Skype. How long before having a lip lift should you wait after having fillers and fat dissolved in the lips? You can dissolve fillers.
I said you wouldn't.
A couple days before, even the same day.
The floss, at least, if you had one long curvy tooth.
Oh no, I got you. Yeah, so your audio is coming
kind
of slow. Resetting. Kyle's on break. All right, so I'll just repeat to everybody that we are doing this little conference of ours right now to explain what's going to be happening on Friday and Saturday of this coming week, the 14th and 15th. We are having a meeting called the Orofacial Club in the Intercontinental Hotel in Miami. It's the first one that we're having. So it is a pilot for what we're trying to set up worldwide. And it's led by Chris Coachman, who's in Sao Paulo. He's in the Guinness Book of World Records for the biggest family of dentists in history. And the whole idea is that dentists and plastic surgeons will come together and oral surgeons to get a greater comprehensive understanding of the face overall. A little stuck? Okay, well, that's fine. So we'll end it now. We're going to save this thing. We'll post it later. Anybody who wants to check out the Orofacial Club, you can, oh, there he is. Let's see if he comes back in. All right, we'll add Kyle back. So anybody who wants to check out the Orofacial Club, you can Google that or go to digitalsmiledesign.com, and that's Christopher Coachman's website. And the meeting is open to everybody. I think it has CME credits with it. Oh, you're back. There you are.
I don't think you can get that easily.
No, so I was just winding down, telling everybody the plan for the meeting. So we're all going to be there Friday, Saturday, and I've never seen a meeting like this, and especially not with the amount of talent that's coming. So people that I really look up to, and I think it's amazing that they're all really interested in coming because they think it's going to be a great meeting. So they're coming from everywhere. Again, we have doctors from Brazil, from...
I'm excited just to go as a student.
I know. No, me too.
Yeah.
Me too. I think, funny enough, out of everybody there, the two of us are probably contributing the least compared to really like what everybody else is bringing to the table. And I'm dying to see, you know, like Chris's talk about the quest for beauty, which is completely unrelated to the actual medical aspect of things.
Right.
Yeah.
Yeah.
All right. Bueno, pues vamos a saludar a todos. Buenas noches a todo el mundo. You want to do yours in Portuguese?
Yeah. Boa noite a todo mundo. Nós vamos falar mais tarde. Obrigado. E nós vamos falar mais tarde.
Bien. Nos vemos in Miami.
Exatamente.
All right, Kyle. I'll be seeing you soon.
All right, man. Talk to you soon.
Right.
See ya. Good night.
Good night.